Hello. When you feel somebody's pulse, you're feeling their heart beating. The heart rate, or pulse rate, is the number of times your heart beats in 1 minute. A normal heart rate is between 50 and 90 beats per minute, but it can vary. It can speed up or slow down depending on the situation. Someone's heart rate can go faster if they are developing an infection, exercising, are very anxious, are dehydrated, are in pain, or if their heart isn't pumping properly or regularly. Someone's heart rate can be slow due to medication or because of problems with the electrical circuit in their heart. Even if the rest of the person's vital signs are normal, you must raise concerns about changes in their heart rate. A pulse can either be regular or irregular. If the pulse is regular, then each beat happens consistently and in rhythm, like this. An irregular heartbeat feels different, a bit like this. It may feel like a skipped beat, or you may feel that the rate swaps from fast to slow. If the pulse is irregular and you haven't noticed this before, you need to inform your manager or a senior colleague. The person may be known to have an irregular heartbeat due to a condition called atrial fibrillation. There are several different ways that you can measure someone's heart rate, and it is important that you follow your organisation's guidelines. Blood pressure machines usually measure the heart rate as well as the blood pressure. Ask someone to show you if you aren't sure. Most pulse oximeters can also measure the heart rate. Unfortunately, electronic devices are not very good at measuring the heart rate in people with an irregular heartbeat. The most reliable way to measure heart rate is to feel someone's pulse in their wrist. To do this, gain consent and explain what you're doing. Turn their hand over so it is palm side up. Place 2 fingertips in the groove at their wrist, about 1 inch from the base of their thumb. When you can feel the pulse, start counting the number of beats in 1 minute. Record the heart rate in their notes. Once you have counted the heart rate, you need to document it on the paper news chart or your electronic record. If you have felt an irregular pulse, you should also document this in the notes. Remember to tell your manager or a senior colleague if you have any concerns.